So, uh, I am Dr. Kewal, and today I am going to tell you about the mechanical pump. The mechanical pump can replace the heart. So, your heart is also like a pump. The function of the heart is basically to take the blood from the other organs and put it into the lungs, and then the blood from the lungs gets oxygenated, and then it comes to back to the left ventricle, which ejects blood into the body. So heart itself is like a pump. So if this pump is not working, we can use an artificial pump nowadays. The artificial pump does the same work which the heart is doing. The only thing is the energy source remains outside the body, like the battery is the controller. So what happens is these patients, when the heart function is very poor, ejection fraction is 15%, 20%, then the patient cannot walk properly, the patient cannot breathe properly, the patient cannot do the properly work which the other patients are doing. So what you can do is we can put the pump into the instead of the heart. So the pump, which what it does is takes the blood from the heart and put back into the body through the aorta. So it's called an artificial heart or ventricular assist device. It can be on the left side ventricular assist device, it can be on the right side ventricular assist device, or it can be both sides the ventricular assist device. So what you need to do is, when you get the symptoms of heart failure, like swelling of the leg, swelling of the face, or your kidney function is poor, you cannot pass good amount of urine, your breathlessness is there, then you go to the doctor and doctor tells you your heart is weak. Many patients, they die if they are not treated in time. So better to reach to those doctors, those who can treat you or can give you these options for the heart. The mechanical pump, what we do with the mechanical pump is we put the mechanical pump into the heart, which is called LVAD implantation or syncardia implantation. So once we implant the mechanical pump into the body, it takes the blood from the ventricle, and the 5 liters of blood, the impeller rotates and gives to the body. So now you are getting the normal cardiac output for the body, which is 5 liter. So if the patient is getting 4 to 5 liters of blood, then he's no more patient, because you are getting your all the organs are sufficiently perfused, all the organs are working fine, so your body will also be working fine. So what the advantage of being energetic, or advantage of being the heart function is okay, that now your heart is doing really well, so you look like a healthy person. And this mechanical pump, which is a ventricular assist device, it is made of titanium, and it does not cause any reaction. Like if you go for heart, if your heart is weak, you go for heart transplant, you have chances of rejection, that your body may not accept the organ which was put into the body, or the organ which may not accept your body. So in ventricular assist device, you don't have to take immunosuppressions, the costly drugs, to avoid that. So it's better if you are immunogenic, or you have more chances that you are going to reject, your PRA level is high, it's better to go for mechanical pump. The advantage of mechanical pump is we can put it within 2 or 3 days. You don't have to be on the waiting list of heart transplant. And another thing is, which I mentioned to you, you don't have to take immunosuppression, which you require after the heart transplant. And the another thing is, if your patient is 120 kg, 100 kg, it's very difficult to find a donor of similar height weight. LVAD can take care of everything. And the most important part is, now this mechanical pump works as bridge to candidacy, means those patients, those who have a high pulmonary vascular resistance, you cannot do the heart transplant. But if you put the ventricular assist device, that reduces your pulmonary vascular resistance, so that you can take a very good breath, and it at the same time it will pump enough blood to the body, so that your body will not be affected by the decreased function of the heart. So it's both way it helps in. The only thing is the drive line which comes out of the body, which is connected to the battery, you need to be charging the battery every 22 hours. But we have patients, those who are in our hospital max, like they came 5 years ago, or still they are on the artificial pump, artificial heart, this mechanical pump, and they are doing their life. Their life is really well. There's no compromise in their life, and they believe that now they have got the second life on the same earth. So they are very happy with and their families are also happy that had they not gone for chose the mechanical pump, they would have died 5 years ago. So they could not see what they are seeing now. So my purpose to tell you, if your heart goes weak, your heart function goes poor, like 15% EF, 20% EF, and you feel symptomatic, your breathlessness or other problems, you don't have to worry that now you would die, because death, stopping of the heart is death. So now even if your heart is weak and gonna stop, we can say give you another life. It's a new lease of life to somebody, that those who get the LVAD, because now you are going to live for longer periods, next 13 to 15 years. And the another advantage of mechanical pump is, if I get a heart attack or you get heart attack, we would die. These patients, they will not die, because their heart is whether working or not doesn't make any difference. So this pump is very important to keep the life going on. Like, people used to die at the age of 50, at the age of 55, when bypass surgery, stenting was not there. So it came in 90s, and the average life was 50 years, 55 years. So after stenting and bypass surgery, now the life has gone to 70 years. Mean average age is 70. We will make it to 90. We will give people more 20, 15 years, 20 years. And nobody would like to die. So they want to live a longer life. Even if an 82-year-old, if you are told that your heart is weak, you would die next 1 year, you don't want to die. You want to keep, maybe even if you are given 8 years, you would like to take that. So that is how it works. And the device is not very costly. It's only 1 BHK, or cost of the 1 BHK. So, and the only tablet which you need to take is a 2 rupees tablet, that is called acetrom, with that every day, nothing else. So, and your heart function will remain fine. You will be doing everything fine like a normal person. This is my message to all of you, those who have weak heart function is poor, or the heart cannot meet the demand of the body, they should go for mechanical pump, and they live their life as long as they want to live. Pump not only increase the survival, that your quality of life will also be increased. So to all my physician friends or other people, those who know that some mechanical pump is existing, and now we don't let you die only because of heart. That is for sure. You may die for some other reasons, but for heart, it's been taken care of. We have done operations over a lot of people, those who are above 80 years, 81-year-old, 83-year-old, and they are living their life for the last 3-4 years really well, without any problems. Even the younger population, everybody is doing fine. So, and there are few complications which are related to any procedure, like mild stroke or bleeding or something, but it's not much. You don't have to worry about this. Not very risky. So, and this pump comes from the this pump is basically keeps you alive for a longer period of time. That is what I mean. So now you have another heart which is controlled by the battery, and you are living your life as you want to. That is the message I would like to give you. Thank you very much for listening to me. Thank you.